This video lecture is intended for use in PSY 101 General Psychology at Jefferson College. Students should read the accompanying textbook chapter using the provided learning guides to begin note-taking prior to viewing the video. The video lecture should then be used to enrich notes and the encoding of the information. This video goes along with the textbook Chapter 15, The Treatment of Psychological Disorders. We will be covering the biomedical therapies in this video. These learning objectives from Chapter 15 are covered in the biomedical therapies video. There are three different types of psychotherapy: insight therapies, behavior therapies, and biomedical therapies. We will be discussing the biomedical therapies that try to change the functioning of the biology of an individual in order to treat a psychological disorder. There are two types of biomedical therapies. The most common type is treatment with drugs. Drugs are some sort of substance that manipulates the neurotransmitter's role in communication in the nervous system, primarily the brain. If you remember from chapters 3 and 5 when we talked about the brain and neurotransmitters and variations in consciousness, you know that different neurotransmitters play different roles in the brain. So when we use a drug to treat a psychological disorder, we are essentially changing how a particular neurotransmitter functions in the brain. Electroconvulsive therapy involves applying an electrical shock to the brain. We will discuss each of these treatments in detail. There are numerous drugs used to treat different psychological disorders. The first set of drugs we're going to talk about are called anti-anxiety drugs. These are drugs that are designed primarily to treat anxiety disorders. They reduce tension, apprehension, and nervousness. Drugs within this category include Valium, Xanax, Librium, Ativan, and Buspar. Anti-anxiety drugs play a role in binding of the neurotransmitter GABA to its receptor site. So when this neuron is stimulated, an electrical impulse will travel down the axon. When it reaches the synaptic vesicles, which are sacs filled with neurotransmitters, that will trigger the release of the neurotransmitter. What an anti-anxiety medication does is it makes these sites on the receiving neuron more receptive to GABA, which means GABA is more likely to bind. As we learned in Chapter 3, GABA is an inhibitory neurotransmitter. That means it's kind of like a chill-out neurotransmitter, so it decreases the likelihood of the neuron firing again. So it sort of slows down things in the nervous system. Another type of drug is referred to as an antipsychotic. As you can probably imagine, this type of drug is used to treat psychotic disorders. These drugs are also used for sleep and mood disorders. What we find is that antipsychotics can reduce psychotic symptoms, particularly hyperactivity, mental confusion, hallucinations, and delusions. There are a number of drugs within this class. Thorazine and Haldol are the original antipsychotics first developed in the 1950s. More recent developed drugs include drugs like clozapine. And what we find is that antipsychotics work by blocking the action of dopamine in the synapse. So, if this particular neuron is stimulated, an electrical impulse will travel down the axon. When it reaches the end, it will trigger the synaptic vesicles, the sacs filled with the neurotransmitter, to release the neurotransmitter, in this case, dopamine. what an antipsychotic does is it makes it harder for this dopamine to bind to its receptor site. So it blocks it. It's kind of like putting gum over the lock. And so by doing so, it helps to reduce some of those psychotic symptoms. Unfortunately, at the same time, antipsychotic drugs have a lot of side effects, and those include a feeling of drowsiness and feeling drugged. They can also have more serious consequences, including tremors, muscular rigidity, impaired coordination, and in really extreme cases, they can cause a permanent side effect. That means after they stop taking the medication, the side effect continues. This is called tardive dyskinesia, and it's similar to Parkinson's-like disease and involves involuntary movements, primarily of the face. It also has this impaired coordination. One of the movements that you sometimes will see is something called tongue thrusting, where while a person is just sitting there or trying to talk, their tongue will sort of thrust out of their mouth in an uncontrollable fashion. Another type of drug used to treat psychological disorders are antidepressants. These are medications that we already talked about when we talked about the neurotransmitters, but we're going to discuss them again here. Antidepressants help to elevate mood and can help bring people out of a depression. They are also sometimes prescribed for people who have anxiety disorders and addictive disorders. The most common type of antidepressant is a class of drugs called selective serotonin reuptake inhibitors. These work by blocking the reuptake of serotonin after it's been released into the synapse. Common neurotransmitters include Prozac, Paxil, and Zoloft. Another type of drug is a mood-stabilizing drug. These particular drugs are prescribed primarily for people who have bipolar mood disorder. What we find is people who have bipolar disorder have episodes of high elevated mood called mania or hypomania, and also episodes of low or depressed mood, is that antidepressants don't work very well for them. And so what we find is that lithium in the form of lithium carbonate, which is a lithium salt, or valproate are both used to help stabilize mood. The exact mechanism for their action isn't fully understood at this time. The final class of drugs I want to talk about isn't specifically listed in your textbook. We do talk about stimulants when we talk about addictive drugs, but stimulants are a class of drugs that are used primarily in the treatment of attention deficit hyperactivity disorder. And what we find is these stimulants work because they stimulate the attention and control centers of the brain. When we look at whether or not these drug treatments are effective, what we find is that they are often helpful with symptoms that have not responded to the insight or behavioral therapies. They're also effective for very severe disorders. So, for example, schizophrenia and bipolar disorders are almost always treated with a drug in conjunction with other forms of therapy. But there's a lot of controversy associated with these. We do not have any drug treatment that provides a cure. So the drugs only provide relief from some symptoms. No drug provides relief from all symptoms. And once you stop taking the drug, those symptoms and those disorders can return. There's also controversy about overprescription and some concern that because general medicine, family practice doctors are providing most of the prescriptions for these types of drugs, that they may lack adequate training in prescribing them. There's also concern that the pharmaceutical industry has too much influence, particularly when they are directly marketing their drugs to individuals. The other problem with these drugs is they all have side effects. And that's because these neurotransmitters are not targeted in just one part of the brain or one part of the nervous system. And so when we take a pill, it's going to go throughout the body and it's going to affect all parts of the body. And that's one of the reasons why you have gastrointestinal side effects, upset stomach, constipation, diarrhea associated with these medications, because those neurotransmitters are also found in the digestive system. The last type of biomedical therapy is electroconvulsive therapy. This is when a mild electric shock is passed through the brain in order to produce a seizure. The level of shock does not damage the tissue, so we're not talking about frying the brain. Essentially, we're using the electricity to create a seizure. This type of therapy has been around for a long time, but it is typically used as a therapy of last resort, most often for people who have severe major depression that hasn't responded to any other form of therapy. It's been found to be moderately effective for people that have that type of issue. So in summary, there are three main types of psychotherapy: insight therapy, behavior therapy, and biomedical therapy. These therapies have all been found to be effective, some for only certain conditions, some for many conditions. And generally speaking, we find that psychotherapy works and is effective even for the worst problems. I would encourage you to find the YouTube video, This is Psychology Episode 6, that discusses how psychotherapy is used for the most serious mental illnesses. I am not going to show that video as a part of this video, as it's too long to be included. This concludes the Biomedical Therapies lecture.